What am I recording?
I don't know.
I'll go and have a look, like I said, but I'll just show you what you do. Okay, so the rhinoscope blade, Luke knows at St George they still have globes. Here they do too. They have fibre optics in most other places. The risk is that the globe will fall down a person's throat, so you have to make sure it's working, and you have to make sure that globe's in tightly. So when I came to visit with Luke, so every time you do a cardiac arrest trolley that has one of these chickens tight. So you make sure it's working. You need a rhinoscope blade. Normally adults take about a size 8 tube. You might need an introducer, you might need a bougie, so you set all these things aside for the anaesthetist. Or whoever's doing the tubing, it might be an ED staff specialist or an ICU staff specialist. So this creates a very stiff, malleable tube. So if you have a person that's got a difficult airway to get into, then it'll make the endotracheal tube much easier or more rigid and therefore easier in some cases to pass. A bougie, on the other hand, is to use for things like when you're getting a tube replaced. So someone was initially very difficult to intubate, it was difficult to visualise their vocal cords, it was difficult to get that tube in, they might have a really bull neck, like a little short neck. So this gets passed down the old tube gets removed, carefully not removing the bougie, and then the bougie is used to pass the new tube down. So you might have someone that's got a cuff leak or whatever, wrong size tube, and the cuff's inflated as much as it can be and still they're leaking around it. So then the new tube is passed down this as a kind of a wick. A bougie, I think, is French for wick. I think it is. Sometimes Arabic people speak French as well, because they're Lebanese, especially that's colonised by the French. This is the malleable stylet, or the Malintosh, which used to be one of the brands. So it's malleable, bendable stylet. That's what this is. Okay, and for all of these things to go down, and even to get one of these, not so much that, but either of those into there, you need some lubricant. A bit of KY jelly. You need a syringe to inflate the cuff once it's passed. You need something to tie in your tube with. And you need to have an air viver, and you need to have someone with stethoscope later to auscultate the chest, because it's quite common, especially in emergency intubation, for the patient to have their right main bronchus intubated. Now that, excuse me, definitively they have to have a chest x-ray to confirm the position of the endotracheal tube. And that's why, in a way, it's better to order one quickly, bag them until then, because if you pop them on a ventilator and try and deliver 400 mils of tidal volume to one lung on an 80 kilogram person, you might end up in a lot of trouble. So, excuse me, so that's kind of it. And you may or may not need drugs of intubation. In emergency, we quite often give short-acting neuromuscular blocking agents, so the paralysing drugs